Oh, in
It's
New
here.
York, it's kind of still early.
We're having a heat wave in Wisconsin. So, all right. Well, we are ready to go. So welcome everybody to episode 206 of the On Air Advocate. We're at the On Air Advocate. We look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are here joining us this morning, or if you are catching this on the replay. Now, as always, if you think any of the content that we are talking about today could be relevant or helpful for anyone in your circle, please hit the share button and share the love with others. Well, today I am very excited to have with us Adrienne Terry. She is a mental health counselor, an advocate, and an evangelist, and she is here to kick off National Minority Mental Health Awareness Month.
Yes!
I'm so excited to have you here. And Adrienne, this is your first time on the show. So before we dive into Minority Mental Health Awareness Month, I would love for you to share with the audience just a little bit more about your background of service, community service, and all the things that you do before we really get into the mental health aspect of it.
Okay, great. Thank you so much. I'm so excited, everyone, to be a part of the kickoff for the National Mental Health Awareness Month with the On Air Advocate. I thank you for this opportunity. Like you said, my name is Adrienne Terry. I am a mental health counselor, currently working on my license. Should be hopefully by 2021. COVID has kind of slowed my process, but I am what you would call a public servant. I have been created by God to be on this earth to provide public services, and I've done it all my life. I've worked in social services for over 25 years, working with the homeless, mentally ill, substance abuse, HIV, families, every population you can think of, I've worked with. Currently, I am the program director of a mental health shelter for homeless, mentally ill women, and I am also a mental health advocate, and I became a mental health advocate out of the need and desire for people to really understand what mental health is and get educated on it so that they won't fall victim to the recidivism of services or recidivism or deterioration in the system as a mental health person, a person who suffers from a mental illness. Currently, I'm also the founder of Multicultural, faith-based mental health network. Hello to all my members. And basically, it's a worldwide network that connects different people, different clinicians, but most importantly, it educates community leaders and spiritual leaders on mental health so they can hopefully implement services and programs within their churches and their community to now further the agenda of mental health awareness in our minority communities.
You know, as I was reading through all of your stuff, Adrienne, I just have to, just for a moment, say, you are truly like the embodiment of be the change. Be the change, leave the world better than you found it. You know, it brought me to tears when I was reading all of that and all that you do and our discussions that we've had. And now you seeing how all of the rippling effects of COVID, you know, have affected the people that are in your shelter and all of that.
Yes.
I just think that you are so right that God truly gives each and every one of us our God-given talents to use, you know, as purpose to give back. And you are truly the embodiment of that. And so I thank you for being here today. And I thank you for being here to also educate on kind of the beginning stages of National Minority Mental Health Awareness Month. Like, where did that start and how did that start? And you educated me on it, which I love. Like, you brought the light to it, that it didn't get the highlight, you know, once, you know, for the person who actually brought it full circle. And now in our present day and age, it's really coming back to light again. And so I would like you to share a little bit of that history.
Okay, well, thank you so much for being, open to learning. Look, my glasses on, but I just want to tell you how my desire for this occurred. I've always had a desire, like I said, stated before, to really educate our communities, because a lot of minority communities do not understand mental health. There's a lot of stigmas around mental health, and because of that, a lot of people don't get the service and treatment that they need, and they end up in programs like mine. So why not avoid that by reaching out to our communities and educate them, and educate the families as well, so that people don't end up in that situation where they're now in shelters, they're in and out of hospitals or in institutions. So as I was doing my research about 4 years ago, I came across BB Moore Campbell. And she was someone who kind of had the same cause. And and I'm going to read a little bit of insert from her biography, but she also was someone who wanted to get the awareness out about mental health. So let me just read a little bit about her and educate us all. I want to just read a little bit about her career. BB works a fictional with often, she was an author, right? She was an author, and she was an American author, journalist, and teacher. Campbell was the author of three New York Times bestsellers, Brothers and Sisters, Singing in the Combat Choir, and What You Owe Me, which was also a Los Angeles Best Book of 2001. Her other works include the novel Your Blues Ain't Like Mine, which was a New York Times notable book of the year and a winner of the National NAACP Image Award for Literature. Her memoir, Sweet Summer, Growing Up With and Without My Dad, and her non-fictional book, Successful Woman, Angry Man, Blacklashed in 2 career marriages. Her essays, articles, and excerpts appears throughout history. However, she also wrote a book called 72 Hours, which was a book that she wrote after dealing with the mental illness through her daughter. And 72 Hours, just to let you know, back in those days, if you had a family member who was hospitalized for a mental health issue, they would hold them in psychiatric hospitalization for 72 hours, and they would monitor them and then release them or hospitalize them. And she spent several 72 hours intervals at different times in the hospital with her daughter. So that's what led her to write the book 72 Hours that deals with mental illness. And out of that, she became a member of the National Alliance on Mental Health. And that book actually helped her win an award with them. As a member, she also was now a founder of the National American NAMI, which is called NAMI, in Inglewood. So she actually founded a chapter in Inglewood, Los Angeles. And her desire really started growing for mental health and getting the information out there. And she was well connected to a lot of celebrities, a lot of, because of her being an author and being known as a renowned author, she used her influences to work with National NAMI. And she recommended that there was a month set aside for minorities to acknowledge the need of mental health awareness. And let me just get the year. And she fought for this. And finally, in 2008, the House of Representatives in Los Angeles actually passed that July would be the National BB Moore National Minority Mental Health Awareness Month. And this grew, like I said before, it grew out of her passion, out of her personal experience, and out of her connections led to now every July annually is now the National BB Moore Campbell Minority Mental Health Awareness Month. Now, she passed on in 2013. She's no longer here with us. She died young. So when she died, it kind of, went to the wayside. But myself and others have now picked up the torch, and we want to carry this legacy of hers to move forward, to help our communities, because the problems still exist. You know, the problems didn't go away when she created it, and the problems didn't go away when she moved on, when she died. So we're here, and I'm one of the people that want to bring this agenda back, carry the torch. I also work with National American, the NAMI in New York chapter. I've reached out to the executive director, and they have responded. They're probably going to be part of on-air advocate this month as well for the New York chapter. So that's what it's all about.
Right.
Tammy, I'm here to carry this torch, that the desire and passion that she had, to carry it now to the next level, and understand that it is so imperative and important that we as a minority communities, right? And I don't just mean people of color. Right now, can I just say this? In my shelter, I have Asian people, I have Jewish women, I have women from India who escaped domestic violence. I have women from all minority nationalities, and the awareness of all these communities are so important. And just so that you know, a lot of the women that are in my shelters from other nationalities are there because of rejection and stigmas of their family, because they do not know what mental illness is. They think that it's evil and it's wicked. So I feel that if families and people are educated, we would avoid all this in the future, and people would get better services and better treatment.
Yes, definitely, definitely. And I mean, you see that on a daily basis, and the need for it. But within our different communities, it's like if the services and the resources aren't there, if the education isn't there, how does it ever come full circle? You know, even in our communities, looking at I think the COVID situation, easy way to break it down, you know, if the people who are living in the communities don't have the resources to go get the hand sanitizer, don't have the resources to go get the things to keep themselves not infected, how are they going to stay uninfected? If they don't know the proper way to wear a mask, if no one shows them, how are they going to? If we don't make our communities aware of mental health, and we don't reach out and we don't get into the communities, you know what I'm saying, and give them the resources they need, how are they going to get better? And how are we going to be able to see that this is a mental health issue? You know what I'm saying? And not because when I look at even homes, I always say, do you think that someone just ended up there? You know, I'm sure that you can speak to that very well. And I'm sure that you have some amazing stories, you know what I'm saying, of like how people ended up within that shelter. It didn't just happen. You know, nobody wakes up one day and says, you know, this is where I'm going to be. But I even look within our population of differently abled, with the services and the amount that's provided, even Social Security. If you don't have the mental capacity or the intellectual capacity to write checks, to know how to ride the bus, to do those things, but you also don't have a family that's going to take you in, how are you supposed to survive? You know, within that, and that breakdown just continues then. And, you know, that's how so many end up also on the streets, you know, and into shelters. But I think that, as we know, knowledge is power, but we have to get that knowledge out to our communities, you know, and you being a leader and doing that, and you are actively doing it. I always say action over words. You are in there doing it.
In the trenches.
Yes, you're in the trenches and you're doing it, and, you know, creating change. And so when we look at, you know, I'm not even going to jump into the COVID situation yet, but like within your community, what are some active movements that you've seen, whether it be in New York or maybe in other states, that really you feel have been positive movements forward in mental health? Is it funding? You know what I'm saying? Are there different programs that are being developed for funding for free mental health resources or free mental health care? Like, what are the things that you are seeing, and what are the things that you think need to be implemented?
That's what so thank you so much. You know, and just to go back to what you were saying, like, how do we get in community? It's people like us. You know, people who are advocates, people who are the voice, people that see a population that doesn't have a voice. And that alludes back to our conversation about the disabled young people that want to really work, right? So you're that voice. So we have to be the voice for those who don't have a voice. So right now, pre-COVID, right, there's always been a resource of mental health programs. Unfortunately, you had to hit rock bottom to be, to access those type of programs, like supportive housing programs for mentally ill in New York, and a lot of different resources. However, COVID has changed a lot. I have not seen any federal contracts yet, because I keep my pulse on HUD, because one of my contracts is from the Housing Urban Development, and it's called HUD for short. And I know they put a lot of money into mental health programs and resources. So I haven't heard anything. I have my feelers out to see what COVID is going to now birth, what system is going to birth. I do know that COVID has changed the model of services, of how we actually do services. So in New York, we have what's called the client-centered service, where model, where this is how we work with clients. We center the services around client. But however, before we even now get to that, it has to be a protective model. And what that means is that before that client even come into your office, you have to now disinfect, you have to put on gloves, you have to wear a mask, you have to give them masks, you may have to have plexiglass. So everything has to be secured, and to not only protect you, but now to protect the client even before the client walks in the office. And that's a layer that now is going to have to be part of social services. It has to be. What do I want to see? I would love to advocate. I want to work with some advocates in New York, or maybe get some advocates from other states, to see if we can get free to low scale mental health wellness. And now remember, mental health wellness is different from mental illness. Mental health wellness, as all of us have a brain, all of us need mental health wellness, right? We need that. But mental illness is more biological. It's something they're born with. But what I would love to see is free services in the form of counseling that address mental wellness and mental illness for low income New Yorkers, or people who have a low income range, those that are maybe on public assistance, as we call it in New York, or have low paying jobs. There should, after this pandemic, there should be free services available, especially for those families that had to be in quarantine with children. It should be free mental health services for those children who had to be quarantined. Tammy, I see this as not a just New York or even United States. This is a world trauma.
Right.
We all share, and we have to heal as a world, right? And we have to now put things in place in order to heal the world. And speaking of healing the world, in terms of the spiritual community, what I found is that a lot of spiritual leaders are now embracing mental health ministries, right? Because in the past, the stigmas has been, is wicked, is evil, or just prayed away, what have you. But now they're understanding that they have to be equipped in their ministries to now at least have the education. So if someone comes into their ministry with mental health issues or mental disease, they'll be able to address it and refer resources, or refer them to the right type of treatment programs. So I'm seeing that now. I'm seeing that a lot of people are embracing mental wellness and mental health. So I'm hoping, my hope for the future is that we become a society to understand that, for one, it's okay to not be okay, right? Especially in this, it's okay. For two, break down the stigmas, right? Break down the stigmas of mental health. And for three, you're not alone.
Right.
This is not an alone problem. You got people in Pakistan feeling like you got people in Africa feeling like you got people in Russia. This is a world pandemic and you're not alone. And it's okay not to be okay. And now that you understand that, what do you do?
Right, right. In New York, in the shelter that you work in, or in shelters in general, do you know, do they provide any type of mental health help? I mean, they work with a social worker, but do they have any outlet? Like if they're staying there, in the shelter, is there any mental health help that comes, or mental wellness help that comes into shelters?
Well, let me explain the system. So in New York, unfortunately, we have the greatest homeless system in the country. I get people from all over the world. Like I've literally sent people back to Germany, Africa. Like the Department of Homeless Service will buy you a one-way ticket if you live in another part of the world. They will. So
Okay.
when you come, the way New York City systems are set up, you have to come through what's called an assessment shelter. And in that assessment shelter, they're assessing you to see what your issue is, right? So let's say they're assessing you. Once they realize what your issue is, then they refer you to a program shelter. So we have various program shelters in New York. We have shelters for people with HIV. We have shelters for people who have substance abuse. We have shelters, and these are specific shelters for people who are working. We have shelters for people who are general population. That means someone like you and I who just became homeless. We have specific shelters for mental illness, right? So we have different populations. So now my women have been assessed by the assessment shelter, and they have seen a psychiatrist, and they have been assessed to have a mental disease. So now they're eligible for my shelter. So my shelter is an entire shelter is a mental health shelter. And it's equipped now with all the components, psychiatrists, social worker, clinicians, therapeutic. So we're equipped with all the services now to help that mentally ill woman get to her next level, even into supportive housing for mentally ill women, homeless people.
And you would say that, so the New York is the leader in that. When you heard from other states, I mean, that sounds like it's a pretty, well-tuned system.
Yeah, it is. It's not the best, but it's the best in the country. And like I said, we get people from all over the country, all over the world that comes to New York just to get into our shelter system in order to navigate the system for permanent housing and services.
Wow. Wow. And how have you seen the ripple effects of COVID, and knowing, as we talked about before the show started, that COVID isn't going anywhere. It's not gone. So if anyone thought it was gone, it's not. And so what do you see with that? Are you guys, is there lots more layers now to jump through to get the help that people need because of COVID? Because I know that even at a normal level of going to a hospital right now, or going for help, you know what I'm saying? There's all these layers of jumping through to get to your provider of any kind, whether that's mental health or your regular physician, just for the safety aspect of it. Do you see that right now as putting up barriers for people? Like people are not being let into the system as quickly, and the process is moving much slower?
Everything is moving so slower. Just to let you know that we're practicing social distancing in a shelter. So where a dorm had 10 women, it's now 4.
Wow.
We have protective gear for all the ladies there. In terms of their medical and psychiatric treatment, I have an on-site psychiatrist who help the women with medication because they may not be able to see their personal psychiatrist, right, within 2 months. We don't want them to run out of medication. So I do have a personal, we do have a psychiatrist on site as well as clinicians on site. But what has really been the downfall is that a lot of the day programs that they go to keep them occupied, right? They give them that layer, like day programs they go to that's more recreational, therapeutic, educational. Those have been closed because of COVID. So now they're quarantined, or in a sense, in a shelter as well. they can go out, come in and out, but there's nothing for them to do. And we have to now, my staff have to now be very creative to do therapeutic things. One of the good things is my program is like one of the only programs in New York with a garden, beautiful garden. So on the weekends, my staff is able to take them out. They have to maybe put little franks on the grill, So we have that little leverage, but the downfall is that the programs that would really help them, the outpatient or the day programs, have been closed.
Right. And I mean, at that level, within that quarantine, we all know how much trauma just in our own homes, that we've all experienced from this isolation. I feel like if you are in the I guess unique abilities community, and you have, you're more used to that transition of change and being a little bit more isolated, but for the greater population, that's a whole nother layer of trauma. Absolutely. That isolation that you haven't experienced before, and not knowing when those programs will open back up, because sometimes that's what people look, for every day, right? Like their purpose, who they connect with. And so now, the mental health and mental wellness that was maybe already a little bit escalated, don't you think, after this, and as we see ourselves into 2021, is just going to grow? And so we really do need to have programs in place,
Exactly. Exactly. So it's been difficult, but I haven't had any psychiatric hospitalizations, which surprises me, and because we as normal people, what we could consider normal, have gone through trauma. But I think that we have supported them enough, and knowing that we have the psychiatrists on site and the staff that they can talk to and things like that. But education is the key. Education, awareness, knowing about what is going on in yourself. And let me just give an example of one of my young ladies who, and I call them clients, but I call them my ladies too. She was depressed. She was sleeping all day in a chair. We engaged her, kept engaging her, kept motivating her. And one day she just got out of the chair, like she was sleeping in the TV room, and she just changed. And now she's, long story short, she's working as a security guard. She went back, got a security license, and she's working as a security guard. Like, it was day and night, and it wasn't anything with the medication. It's just that the whole separation from her family, the COVID, put her in a down mood. But when you engage people and you encourage them and you assure them that they're still a good person, like, because of this, it didn't ruin who they were, and an extra pill here and there. So.
Right. No, just so much now, this is just the kickoff of this Minority Mental Health Awareness Month for us here at the On Air Advocate. This is the kickoff. But I would love, as we kind of wrap up today, you letting us know of any resources that have been so beneficial to you, that you think are great resources that are out there. Obviously, your private group that you have and all of that, we can drop that below so people can connect with you if they have questions. Yes. But are there outside organizations that you would really say, hey, this is great to connect, this organization is great to connect with for resources, or also for getting information to spread the word, right?
That's right.
Advocate.
That's right. Advocate. And, one of the things I would say to the audience is, this is a time to really educate yourself, because, let me just share this, Tammy. I was interviewing on one of my shows a doctor by the name of Dr. Tay, and she's a trauma specialist. And I said, okay, Dr. Tay, where do we go from here? Like, where do we go? We're making all this up as we go. There's no formula. Right. And she said, we have to go 8. And I love this. And I said, what do you mean 8? She said, A, we have to accept our new norm. We have to accept that this may be the new norm of our life. P, we have to prepare ourselves for this new way of life. Mentally, physically, prepare our home, our jobs, our way of traveling. We have to prepare. And E, we have to educate ourselves.
Yes.
So I say that to the audience. Let's go 8. No. But to really use that acronym, think of it. Let's accept where we are. Accept that it's okay not to be okay. Accept this new norm that we may have to live the rest of our lives. Prepare ourselves mentally, and prepare our home, prepare our children, prepare everything that we didn't do, even the way we travel, right? Even the fact that we have to wear masks the rest of our lives. Let's prepare and educate ourselves. While you're looking at this live today, you're starting the educational process, and that alludes me now to resources. I know that this platform may be around the country, right? So I don't want to give resources specific to New York City, but what I want to do is I want to help you to go to Google your local National Alliance of Mental Health. It's called NAMI. It is NAMI. Every state has one. They're a worldwide organization, and they are so resourceful. If you go there, you'll look under education. They have so many workshops for families around mental health. They have educational workshops for mental health in general. They have all kinds of resources and trainings in your state. So I want to first direct you there because they're the ones that set up in each state to help. And a lot of people don't know about NAMI, Tammy.
Right.
NAMI, Tammy. A lot of people don't know about Tammy. Become a volunteer. Become a member. Get active. Let me tell you something. If you really want to reach out and help in your communities, get active with your local NAMI. They're really looking for people to push the agenda of mental health awareness to your community, your state. Now, in terms of individual, if people have individual needs, please leave them in any needs of resources they may want that I may have, but it's not, I don't know, because this is a platform.
Yeah.
Leave them in the message, the comment section, and I will get back to you. Anything about domestic violence, anything about mental health education, anything about where do we go from here, just put that down in the comment section, and I promise to get back to you. Of course, the national suicide number, let me just get that. And I just want to say something to that, because people always say that, well, I'm not suicidal. I don't want to call the hotline because I'm suicidal. You know what? It's not even about being suicidal. Sometimes you may be in a mental health crisis, right? And you just need someone to talk to. And it's so when we say the National Suicide Prevention Network, yes, they will help you with that, but they could also be a resource for you in your state or someone to talk to. So that number is 1-800-273-8255. Let me repeat. This is a national, and you will put it in the comments. National Suicide Prevention, 1-800-273-8255. And like I stated before, don't think of it, just think of it as a number that if I'm in crisis, right? Or a number that if I'm in crisis and I need someone to help me in my state get resources, they can help you as well.
Yes, and when you spoke about NAMI actually, they do those workshops, and sometimes different states have different ones, but a lot of the information is the same. So you can also check out other states if you're looking for their classes. In our On-Air Advocate community, I'll share later this morning, NAMI just came out with, in our state, they're doing what's called, it's like the CPR, it's like mental crisis for our teens. It's like an actual workshop. It's an all day from 9 to 4 workshop that you can register, and it's done online. So I think that it's first aid. It's first aid mental health for anyone that's dealing with teens and young adults. And so, I mean, I'm going to sign up for it. I think it's great, but NAMI is definitely leading in that. The other organization that you spoke of, the American Foundation for Suicide Prevention, they actually kicked off a full campaign as well for July being Minority Mental Health Awareness Month. They have images you can share. They have info you can share. So I've had them on the show before, and I mean, they're an amazing organization. So yeah, both of those. are great, are great organizations to get info from.
And can I say, Tammy, we discussed a lot of this resources, they weren't free before, right? We talked about that. You want to allude to that, Tammy?
Yeah, I mean, I think that you have spoke to this as well, is that so many of the things we've had to pay for going to seminars, presentations. I believe NAMI's national conference this year, which people usually fly to, is a 3-day conference, and I think it's the middle of July. You can register and do the whole conference online for free. So, I mean, when does that ever happen? So, and even education with doctors, I think all the hospitals and things like that have really stepped up to put on these kind of live shows that people can just jump in and listen to. And so after this COVID season, these COVID times are over, I don't know that will be the same. You know what I'm saying? And not knowing how long this will last, but I don't know. I think that once people can safely fly and safely go to conferences again, I think there's going to be some fees attached to some of these things again. So take advantage now.
Take advantage of all the free resources. You know, I tell the leaders, spiritual leaders, you know, get the tools, start building your toolbox, right? Because what's going to happen is you're going to, and just because you're not a clinician, just because you don't have a degree in psychology, just because you don't have the experience, you can get the tools, put them in your box. You never know when you're going to encounter someone either in your family, on the street,
right,
or on your job that needs the tools that you have acquired through educating yourself. And you can help someone. It's not just us. You have the same, if you have the heart and desire to help someone, get yourself the tools that you need so that if these things arise, you can truly, truly help someone.
I love it, Adrienne. I thank you so much for spending your morning with us here at the On Air Advocate.
You're welcome.
I so appreciate it. I know you're going to go back and drop info and information and resources and stuff below after we wrap up this interview. I can't wait to have you on the show again. So we will be back. This won't be our only, you know, and check in and see how
we got some work to do together, Tammy.
Yes, definitely, definitely. So I thank you so very much for being here, sharing with us this morning. I look forward to the rest of this month, sharing, all that is to come. So with that, thanks again. And if anybody wants information about the resources that the On Air Advocate has to offer, you guys can head on over to onairadvocate.com, and all of those are right there. If you want to join our private community, you can head up to the top of this Facebook page, hit the blue button, and that will let you into our private group. Adrienne's going to drop below her private community so that you guys can get involved with that as well. And so on that note, I hope everybody has a blessed Wednesday, a great kickoff to their month of July. Keep spreading awareness, right? Adrienne, use your voice.
Thank you. I will.
And know that you are not alone.
You are not alone.
Yes. All right. Thanks so much, everybody. Bye-bye.
Bye-bye, everyone.